Welcome to another episode of the Health Tech News brought to you by Medics in Tech. This is June, and I'm super excited to host you to another episode. Today, there are exciting updates as usual, so without wasting time, let's get into it. Welcome back. First on the news today is the news from Lagos State, Nigeria. PKB, Patients Knows Best, wins a single patient record contract for Lagos State, Nigeria. Following the partnership between InterSwitch Group and the government of Lagos State in Nigeria to introduce the Lagos State Health Information Platform, Lagos SHIP, InterSwitch has selected a company called Patients Know Best, PKB, as a key partner in providing a single patient record SPR system for the state. This pivotal contract will enable the government to host over 20 million health records for citizens, marking a significant step for healthcare infrastructure of Lagos State. Now, aside from hosting patient records, the PKB's comprehensive platform provides a user interface that empowers patients with tools for active engagement, questionnaire, collaborative care planning, symptom tracking, and secure messaging. However, the initial phase of this Lagos SHIP project will focus on establishment of the foundational data hosting infrastructure. Now, let's take comments from individuals about this innovation that has come to Lagos State, Nigeria. According to Olufemi Olupega, the Managing Director of Digital Health Platforms at InterSwitch, InterSwitch collaboration with PKB underlines our broader commitment to driving digital transformation across critical sectors in Nigeria, including healthcare. By leveraging cutting-edge technology to streamline healthcare information exchange, we are building that enhances service delivery, improves patient outcomes, and redefines healthcare access in Nigeria and beyond. Also, there was a comment from the CEO and founder of Patients Knows Best, Mohammed Al. According to him, we're incredibly proud to partner with InterSwitch on this transformative project for Nigeria. We have a long track record partnering for governments on innovations such as the NHS app in England, NHS Wales app in Wales, and PGOS in the Netherlands. Over the past 17 years, the patient-centric approach is delivering better patient care in more and more health economies. Nigeria's commitment to leapfrogging to a modern, patient-focused system aligns perfectly with PKB's mission. We're seeing a clear global shift towards investing in single patient record systems with significant interest from many major markets. From his comments, he mentioned the NHS app. And in one of our news editions, I shared some updates about the NHS app and the innovations that have been coming to the NHS recently. So you should do well to follow all our episodes to ensure you're updated in all that's happening in the world of digital health. Well, I'm super excited for Lagos State, and I love that they're embracing innovation in the healthcare space, hoping that this gets to all the states in Nigeria. Now let's go to the next update. Next on the news, Blüm Technology Group has acquired the Nexus Digital Technologies. The Blüm Group Technologies recently announced its acquisition of Nexus Digital Technologies in what it is calling a strategic expansion in the primary engagement and community care space. The Blüm Group Technologies specializes in digital health solutions, including AI, software engineering, and regulatory support. So in acquiring Nexus Digital Technologies, the Blüm Group hopes to be able to deliver a more end-to-end digital health services for organizations requiring support with digital transformation, which will help them broaden their capacities to assist in areas across patient education, peer-to-peer support, direct access to digital health professionals, and connections to local services. Now, within this short period of acquisition, Nexus by Blüm has reportedly already begun to explore opportunities in oncology, rehabilitation, and primary care. Let's quickly take a comment about this acquisition from the founder and CEO of Blüm Group, Michael Watt. According to Michael, this acquisition has not only enhanced the capability of Blüm's existing product portfolio, but it is a bid to support founders, save jobs, and maintain continuity of service between industry and the NHS. Now, this is why I love acquisitions. First, it helps to improve innovative solutions in a way that bigger companies get to invest more in companies that are already making impacts, making waves to expand the scope of what they're doing and reach more people. And also, of course, when you create more products, more services, you're able to create space for more jobs. So, well done to Blüm Groups for this acquirement, and I hope to see more innovative solutions coming out of Nexus by Blüm. Now, let's move on to the next update for today. This particular update is not the usual you would think of on the health tech news. Well, let's get to it, and you know why I had to say this. Next on the news, vaccine makers face fresh uncertainty after firing of CDC panel. Did you hear the word firing? Now, this is your unusual news. Let's get to more details about this. Health and Human Service Secretary Robert F. Kennedy Jr. has abruptly fired all members of the committee guiding the Centers for Disease Control and Prevention's vaccine recommendations. In an op-ed published in the Wall Street Journal, Kennedy said this move was designed to re-establish public confidence in vaccine science and eliminate the conflict of interest and skewed science pervading the panel. Now, that is Kennedy's opinion. Do you think this could be the reason for this, or could there be more reasons to it? Again, let's get to more details. There was a comment from an analyst about this firing of members and replacements. Their replacements could be more aligned with RFK Jr.'s disproven beliefs about the alleged dangers of vaccines. The abrupt termination of the 17 panelists guiding the CDC's vaccine recommendations could yield a new committee more aligned with Robert F. Kennedy's Jr.'s skeptical views. From that comment, you're getting the gist of the news already. Let me give you a backstory to help you get the full context of this news. Prior to the firing of this panel, vaccine makers were already under intense pressure. Since new leadership has taken over the U.S. public health agencies, the Food and Drug Administration has announced stricter guidelines surrounding the use of COVID-19 shots and called for a more vigorous testing for the vaccines in development. So companies such as Novavax and Moderna have faced regulatory delays and are now taxed with new testing requirements. In the meantime, Kennedy, a prominent vaccine skeptic, has expressed lukewarm support for proven shots like measles vaccine and vocalized fringe theories about vaccine safety. So, the abrupt firing of the 17 members of the Advisory Committee on Immunization Practices adds to the uncertainty. Now, what does this Advisory Committee panel do exactly? This panel consists of a group of independent public health experts who meet several times a year to review data and vote on vaccine recommendations to the CDC director. So to fire this entire panel of committee made up of 17 members, there should be more to it. Now let's take comments for some individuals about their perspective about this. The first comment is from Richard, a lawyer with the firm Epstein Becker Green. According to Richard, this marks the end of a distinguished 64-year period in which the committee guided vaccine policy decisions for the federal government. Also, in a research note, William Blair analyst Miles Minter called the move a hindrance to the vaccine development space, as incoming committee members may have more restrictive recommendations on vaccine uptake and use. And lastly, the chairman of the State Health Committee, Cassidy, went on X to share a comment. Of course, now the fear is that the ACIP will be filled up with people who know nothing about vaccines except suspicion. I've just spoken with Secretary Kennedy and I'll continue to talk with him to ensure this is not the case. So with all of these comments and the back gist about this panel and what has happened, what do you think? Do you also think there is more to this firing, or is something that is needed at this point for the CDC? I would like to know your perspective in the comments. Alright, so let's get down to the last update for today. Next on the news, Tandem Diabetes Care and Abbott launched a partnership to develop automated insulin delivery system using a dual glucose ketone sensor. Now, what is this partnership all about? let's get into more details about this. The first thing to note is Tandem has an automated insulin delivery system. And in this partnership, Abbott is coming on board with a dual glucose ketone sensor. Automated insulin delivery systems pair continuous glucose monitors with insulin pumps to adjust insulin doses in real time. However, no systems on the market today incorporate ketone sensing. Now, Tandem plans to integrate its available insulin delivery systems once Abbott's new system is approved. So yes, the Abbott dual glucose ketone sensor has not been approved. The company announced in 2022 about their plans to develop this sensor. Now, why is this important? According to the company's remark, the ability to detect rising ketone levels in people living with diabetes avoids a life-threatening condition called diabetes ketoacidosis. According to Tandem, our current focus is ensuring our systems will integrate with and support users who adopt Abbott's glucose ketone sensor when it launches. Now, this is why partnership or collaboration is important. So with this partnership, Tandem coming on board with their automated insulin pump and Abbott coming on board with their dual glucose ketone sensor, much can be done in helping patients with diabetes get better and avoid other life-threatening conditions like diabetes ketoacidosis. So, of course, this makes a lot of sense. And aside from these innovations, Tandem is also working on developing a patch pump, and Abbott, on the other hand, has been partnering with more insulin pump makers like Sequel Medtech, and also last year they secured a deal with Medtronic. A big job well done to both companies for working on these innovative solutions. And that's it for the news today. I hope you had a great time listening as much as I did presenting this update to you. So, you know what to do. Ensure you are subscribed to this channel and your notification bell is turned on so you don't miss out on all our updates. This is Medics in Tech, where we keep you updated about all that is happening in the world of health tech. Talk about news, career opportunities, job opportunities. We got you covered, especially if you're someone looking to build a career in digital health. So you can also follow us on LinkedIn to get all of these updates. Thank you for watching till the end. I hope you catch up on the next news updates. Till the next time, bye.